Good morning. Good, Good morning. Am I being heard? Yeah. Okay, perfect. Can't tell up here sometimes. So the power of leadership, capital, execution, and driving innovation in healthcare is something that I have a little bit of experience with Centrifuge. Before we get into that, though, I'm going to share a couple of other stories that kind of parallel a journey of innovation and kind of talk about how does this relate to eventually healthcare locally, the United States, and then globally. So we have leadership, capital, execution, and innovation. And these coming together is what gets us, the collaboration of all this coming together gets us to innovation. So raise your hand if you've ever been to a national park. I'm sure quite a bit of us have been. Well, what's interesting about national parks is national parks came about because of the leadership of one man by the name of John Muir. John Muir was a naturalist, and in 1903, started this journey. In every walk with nature, one receives far more than he seeks. And in 1903, here he is with Teddy Roosevelt, and they are going through the landscape of Yosemite National Park. And here, Roosevelt is representing capital and execution. And here is John Muir leading Roosevelt through the lands of Yosemite National Park. And what's really cool about this story, which I didn't know about till about a week ago, is that these two together is what led to, in 1906, the protection of over 230 million acres in the United States, which millions of people around the United States, but globally, have been able to experience because of these two coming together. And to date, you'll see here, these are all of the areas where we have parks today, from the Grand Canyon to Yellowstone. And that all happened from a trip in 1903. So here we have leadership with John Muir, capital with Teddy Roosevelt, execution was the national parks, and the innovation is conservation for mankind, and that led to other national parks around the world. So now, to do one more story before we get into Centrifuge's story, we're going to go about leadership, capital, execution, and innovation for another one that started here in the United States and now is felt around the world. Does anybody know who these two brothers are? Does the animation help? Well, you might have guessed it. It's Walt and Roy Disney. These two brothers came together, Walt with the leadership, the businessman being Roy, who put the vision, the reality behind the vision of Walt to bring Disney to life. And here's Walt embodying leadership. If you can dream it, you can do it. Here's Roy representing the capital. And the execution in 1955, Disneyland came into existence. After years of persistence and setbacks, together they were able to bring Disneyland, which people from all over the globe get to experience today. But it didn't just stop there. Eventually, Walt wanted to expand and have a hotel that complemented the park. And that required creative financing, where they came up with a 99-year lease and an oil tycoon to back it. And then the Epcot Center was a vision that came about, and this is for Disney World. And what had to happen is Roy went in and formed all of these LLCs. These LLCs were the LLCs that bought up the land before land prices skyrocketed. And today, you can still see this today in the windows of Disney World. So today, you have Disney, a global powerhouse in animation and theme parks that came together because of two brothers having the vision and the tenacity to go after a goal. And today we still feel Disney World. So then how does that lead to Centrifuge? With leadership, capital, execution, and innovation. Well, again, I went a little ahead of myself. Walt Disney was leadership, capital, Roy Disney, execution was animation and parks, and joy for mankind, where millions of people experience it today. So now, how does that lead into Centrifuge? So who here knows what this is a picture of? Yep, back pain, low back pain. Well, the numbers are staggering. Over 90 million people in the United States suffer from low back pain. Over 1 million back surgeries occur per year, and millions of patients are prescribed opioids. So here's a picture of opioids, and one of the staggering figures is over 100,000 Americans die annually from opioid abuse. Half of those Americans suffer from low back pain or claim to be suffering from low back pain. And what's a very staggering figure is 1.5 trillion costs from opioid misuse just in the United States. So this is our story. Centrifuge began in 2018, and with our doctors here and spine surgeons, we came up with an innovative solution of addressing low back pain and leg pain for spinal fusion patients by bringing in stimulation to get them off of opioids and addressing the pain at the point of surgery, not years of suffering debilitating back pain. So it started off with the founder, Dr. Nazmi Payman, a pain physician who wanted to find a better way to treat back pain than just opioids. We had a neuroscientist in Dr. Greg Molnar, who's an expert in neurostimulation. Dr. Michael Park, a neurosurgeon from the University of Minnesota. Myself in finance. And then finally, we brought on Dr. Rohan Lal, who's our spine surgeon, who's here today, our chief medical officer. And by coming together, we formed a company, we formed an innovative solution to tackle back pain for spine fusion patients. So we started off in Minnesota, expanded then to Indiana, and we completed our 15-patient proof of concept study. And the states that you're seeing that are being filled out in green, those states are the states that are where we're going to be looking to expand our pivotal trial. And then once we have FDA approval, well, that did not. We had a map here that showed going to the globe, but that's okay. Patients, so what this is ultimately about is how do we get patients back to their lives? How do we get them so they get back living day to day? So what we have is we have an example of one of our patients, Jason, who's back to full-time construction. Before he had the surgery, Jason was disabled and was on opioids. At 6 months, he was back to full-time work and off of drugs. Here we have Sarah, who was a nurse and didn't want to go down the addictive path of opioids. And she, before the surgery, could not attend her son's Little League game. Now here she is with her family attending her son's Little League game. These are things that we take for granted if we're not dealing with chronic back pain. And then finally, here's Dawn enjoying a motorcycle ride. Before this, she could not even go out and be on a motorcycle, let alone walk. So now what we're going to do is we're going to hear a little bit from the patients themselves that made the news.
And while this is just the beginning, results from the device are looking promising.
In our 12 patients that we've done between Minnesota and Indiana, the device is able to help patients with decreased back and leg pain after surgery and at long-term time points as we get further out.
I was only on pain meds for 5 days following that big surgery. I was back to work and seeing patients at 6 weeks, back to my normal job.
Avoiding long-term pain meds also motivated Sarah's trial decision. Her medical background showed her the negative side of the opioid epidemic.
Being a nurse, I knew that I didn't want to start the narcotics and opioids.
Greiser believes this procedure could shine a new light for those suffering from chronic pain as it continues to reach new phases.
It just makes sense. Spinal fusions aren't new. Spinal stimulators aren't new. They've both been tested and have been found effective. But the great thing is that now they're doing them at the same time.
We're early on proving the concept, but the initial results are unmistakably good.
So to bring this to fruition to where we are to date was a $23 million of capital investment. And there will be more investment that will be required for the next phase. But what this is showing is in order for us to get to the execution of having patients, you have to have the capital with the leadership and the execution to actually improve patients' lives. So here for leadership, to recap, we have Centrifuge, $23 million of capital invested. The execution was 15 patients proof of concept study, which was just completed recently with the University of Minnesota and South Bend Orthopedics. And then finally, what is the main point of health and wellness? It's how do we improve the quality of life in patients? And that's what we seek to do every day at Centrifuge. And that's one of the things that when it comes to leadership and innovation, it's bringing together the things that are necessary to advance these therapies. Now, we have a little bit of time for questions, if anyone does have any questions. But if not, I want to thank the Health 2.0 Conference for having us and appreciate you guys having us here. Thank you.